Now, people who drink at harmful levels or who are dependent on alcohol haven't changed their consumption following the introduction of minimum unit pricing. A new study by Public Health Scotland has found that some economically vulnerable groups experienced increased financial strain, even reducing their spending on food and bills so they could buy drink. Professor John Holmes is director of the Sheffield Alcohol Research Group at the University of Sheffield. He was one of the teams involved in this study. Good morning to you, Professor Holmes. Just talk us through the findings of your research.
Well, the key thing we found here was that there was no clear evidence that minimum pricing reduced alcohol consumption among these higher risk groups. But we do need to consider that finding alongside previous research that's been done on this topic. And that previous research has shown actually that alcohol sales did go down in Scotland after the policy was introduced, and that the biggest reductions in purchasing were seen among the households that bought most alcohol. So our findings do make those previous conclusions a little bit less certain. But we also provided some important evidence in other areas. So as we know, before the policy was introduced, there was a lot of concern that minimum pricing might lead to a range of wider problems for people who are dependent on alcohol or others who are drinking at harmful levels. And we did find some new evidence in that area. So we found that people who were economically vulnerable, some of those did experience financial strain because of the higher prices, and this led to them reducing spending on other things, such as food or bills, or borrowing money from family and friends, and in some cases spending savings. But there were a lot of other concerns as well, and we found that there was no clear evidence of any other wider negative consequences. So we didn't... Sorry, go on.
So I was going to say, so in terms of the wider negative consequences, you didn't see people going out, committing crimes in order to find money to buy booze?
That's right. So we didn't see any evidence of increased crime, either to get hold of alcohol or to get the money to buy alcohol. We also didn't see any increases in people using illicit drugs or drinking what we call non-beverage alcohol, so things like white spirits or alcoholic hand gel. And we also, crucially, didn't see any evidence of people going into acute withdrawal because they couldn't get hold of alcohol. So there is a mixed picture here. We did have that increase in financial strain, and perhaps that's a little bit unsurprising given the policy raised the cost of alcohol, but we didn't see any other wider harmful consequences.
Yeah, what did the people that you spoke to tell you about the impact it was having on their finances? How much were they willing to give up in order to be able to spend that money on booze?
Well, this was very different across the population. So some people were simply able to afford the price increases, and others did report that they reduced their alcohol consumption a little bit by switching to lower strength drinks or different kinds of drinks. But in other cases, they reduced spending on things like food or household bills. They borrowed money from family or friends. And in some cases where they had savings, they ran down those savings a little bit. And obviously that created problems in the household. Those solutions, however, are perhaps not sustainable in the long term. So one of the things we're unsure about after this study is whether those people who've experienced financial strain might then reduce their alcohol consumption in future as those kind of financial responses become unsustainable.
But it certainly suggests that they haven't reduced it so far, and that was the aim of the introduction of minimum unit pricing.
That's right. Although it's worth remembering we have got other evidence looking at the impact on alcohol consumption in general across the whole population, and that evidence suggests that alcohol consumption did go down, and that the households that bought the most alcohol reduced their purchasing the most. What's different about this study is we particularly focused on the very heaviest drinkers, and that actually isn't the group that the policy was perhaps targeting. If you want to target people who are actually dependent on alcohol, there are better things you can do, such as increasing spending on alcohol treatment systems and trying to prevent people getting dependent on alcohol in the first place.
Yeah.
And the Scottish Government has done those things as well.
Yeah, because I was interested in this because the Scottish Government website says that minimum unit pricing was designed to impact on the most harmful drinkers, those who drink regularly more than the lower risk drinking guidelines, and it wanted to bring the numbers of deaths down. So what is the difference between somebody who's drinking at a very harmful level and those who are drinking at a level who did reduce their alcohol consumption because of it? What are we talking about in terms of the level of alcoholism we're talking?
Yeah, the language gets slightly confusing here. So when we talk about harmful drinkers, we mean the 5% of a population who are drinking at high levels but aren't necessarily actually dependent or addicted to alcohol. This study particularly focused on the people who are dependent on alcohol, and that's a much smaller group. So while there is some evidence from other research that that group of people who aren't dependent did reduce their purchasing of alcohol and drank less as a result, this study suggests that people who are actually dependent on alcohol didn't reduce their consumption as much. And as I say, that's not necessarily surprising because we know that group is a very diverse group. It has quite complex needs. And if you want to tackle their drinking, you need to do slightly different things, as I say, such as improving access and provision of alcohol treatment services.
Yeah, it's active help rather than increasing costs. Do your findings damage the concept of minimum unit pricing at all?
I don't think they do hugely. I mean, it would have been nice, of course, to see some reductions in alcohol consumption in this group. But I think they provide a kind of nuanced picture because they tell us, yes, okay, there are some problems with people experiencing financial strain, but this idea that people who are addicted to alcohol, who are dependent on alcohol, would simply go out and commit crime or start taking drugs instead, we found no evidence that those kind of problems were happening. So it kind of allays those concerns about the wider impacts of a policy. We didn't see huge numbers of those kinds of problems.
Where next for the policy, do you think? The Welsh have just adopted it, so I suppose you'll have more facts and figures to look at very soon.
Well, we may not get much good evidence from Wales, unfortunately, because they adopted it just before the pandemic. And of course, the effects of a pandemic make it very hard to see the effects of minimum pricing. What's next in Scotland is probably, firstly, there's a debate in the Scottish Parliament and then a vote on whether the policy continues, and that will take place in 2024. There'll also likely be a debate about whether they should raise the minimum price. At the moment, the minimum price is 50 pence for a unit of alcohol, but that's been the case since 2018. The minimum price has obviously become less effective as inflation has gone up. So there may now be a debate about whether the price should go up to ensure it remains effective over time.
John, thank you very much indeed for your time this morning. Professor John Holmes there, Director of the Sheffield Alcohol Research Group, which took part in this study.